Healthcare Delivery Symposium in Freetown, the chairman of Healthcare Sierra Leone, based in the United States of America, Dr. Michael Pierre, has announced donation of medical supplies worth over $6 million to the Ministry of Health. The symposium was part of the organization's mission to contribute significantly to the improvement of healthcare delivery in the country, as well as support the Ministry of Health to reduce infant mortality through Rotary International Support Help Babies Breathe training programs. Here is the report. Organized by Healthcare Sierra Leone USA in partnership with the Ministry of Health, the Symposium on Healthcare Service brought together the country's medical doctors, nurse practitioners, and nurses from the United States of America to share insights, best practices, and collaborate with local professionals to enhance the healthcare system in the country. The move is to contribute significantly to the improvement of health service delivery, especially in hard-to-reach rural communities. Chairman of Healthcare Sierra Leone USA, Dr. Michael Pierre, said he was excited to be in Sierra Leone for the organization's second annual 2024 medical mission, stating his team is ready to collaborate with local healthcare professionals, share knowledge, and provide vital services to the poor. He said the tireless efforts of the country's doctors, their compassion and expertise have been a beacon of hope for countless individuals and families in time of illness and distress.
Today, Mr. Minister, I want to pledge our unwavering support for what we have done and we are going to continue to do. At the end of this program, we want to donate to the Ministry of Health a total of about $6,550,000 worth of medications.
Dr. Pierre described the gathering as a testament to their collective belief in the power of humanitarian work, power of the community, and power of healthcare.
We have patients going to emergency room. There is no basic equipment to help them make diagnoses. They are very knowledgeable, the doctors here, but they are lacking with deficiency in the equipment that can help them to make the right decision.
All the villages we did, they don't come this morning, and more day on the road back for kind. The first one, the first road in, by the health right now, the gate turn up to the village. The gate turn up. The same, the people then value the health.
Yeah, good afternoon. On behalf of the MOHS and the MMSA, I want to thank Healthcare Sierra Leone USA for this donation for the people of Sierra Leone. And I want to assure on behalf of the MMSA team that this donation will be fully utilized for the intended purpose of the people of Sierra Leone. And once again, I want to thank Healthcare Sierra Leone for this time gesture to the people of Sierra Leone. Thank you.
10 times 10.
of Health 1, Minister of Health, Dr. Charles Senesi, lauded the Healthcare Sierra Leone USA for their continued support to the health sector and underscored the need to improving the healthcare delivery for low and middle income countries, with Sierra Leone being no exception.
Then comes the challenge of mobilizing resources, human, material, and financial. But whatever you do, I say always have it at the back of your mind that you are coming to complement the effort of those to the ground.
In addition to
50%.
I'm going to translate. I can tell what it is.
You want to take me pleasure?
Rudy.
Stop. Who be like stop? A video I did. No.
It don't work. Now acid, before they turn acid, it begin it with skin there. You are inside. So when they eat now, it give you pain. So anytime you eat, you don't feel for it. So now you give you this medication. They want me to take them at least 30 minutes before you eat. So it will begin to take effect. Now one for the give you 30. You ready? Take them with water. On the medication, not to just sip the water or one make it out at least that the normal glass. Half of a win at 4 ounces of water. You take them with them. Do you baby now? If you take this with small sip of water, you see me I don't let water. Now trouble. Okay. Yeah. So this is
Salon. I am a government hospital in Adijela Valley. A retired teacher. Up Central Road. And we tell we say people that they come from America for come with free treatment. And I didn't have with the wife who don't come. The process is very transparent. We didn't do the line long, and one of the mandants he say the line too long. So he create other area for we for go sit down so that nobody understand. Then we don't come, I don't go through the process, and then at the stage now from back the doctor see me, and from there they will give me medicine. So all that process we don't go through, we don't pay money, will not be 1 cent. And the way we see how they give the medicine, I believe say they give the medicine according to the sickness so you get come. All don't retire and I will get any pain then. But they don't see them, doctor don't see them, and they wait for get medicine out.
the medication you for number this. You say one of these every day. I want this medication. Okay, they go take my money. When you wake up, as you begin take these two, they left all the medication in. We need there for 15 days. After this, you begin back and one, they're gonna do this the 16, 17.
Me, I'm glad because I've pay million. I don't care. I'm not paying nothing. I don't get the paper now. They go treat me. They give me medicine. So me, I'm glad.
So now you come with me. You said something on a
I mean, come.
Okay. Now I'm not going to ask that.
They said when you get from the family, let them come. Me family, let them come. Anybody will get sick. Away sick the morning, anytime you get. And for can they can't get this free medical. That's not a free medicine they can't get. You know they give money. You know they spend. If they get for medicine, then they can't see you any problem when you get the cash. So you are beg and they talk to them. And they encourage me family, they not say, thanks, I know they go give money. They know they give me better medicine. No, not like you can no more. They give medicine, and they encourage you fine. So they are beg. And that's how they tell me family. And then they can't. Let this opportunity not pass them.
We collaborate with the Ministry of Health. We see they can give free medication to the people of British. And also, we started this project here since 2 years ago. And today they are switching again. So are there with the chairman? So doctor, you can tell people that people don't know with the
Dr. Michael Pierre. I've been as the chairman for Healthcare Sierra Leone, United States of America.
Yeah. So Dr.
Michael, we get for tell we say all this good work within they do. And then they fund themselves and do a fundraising and raise some amount of money and buy medicine for the people. Listen to
this, I would say the fund myself, and because we work the born in Sierra Leone and we work in America, so we don't look at the system in this country. We don't say what people that not get. We don't look for government for sponsor. So we still reach out to pockets them. They will say go back.
So which kind of medication they want to send it to people of Boya Beach?
Well, we get medicines that we can cover chronic medical issues such as hypertension, diabetes, kidney problem, rash, asthma, so many antibiotics for infections. We get that kind of medication.
People come out all angle from the peninsula just for can benefit from this free medication where the healthcare seal in USA provide for the people of Boya Beach community. We see people that come out from Waterloo, people that come out from Tongo, people that come out from 55, Kent, and they all coming up now Boya Beach just for can get this free medication from the healthcare seal. The Ministry of Health and Sanitation, we provide ambulances and also mobile health clinic buses for the healthcare Sierra Leone, USA, for let them go embark on this mission, and definitely the mission became out successful one. So we want to tell the Ministry of Health, we want to plenty thank you to the healthcare Sierra Leone USA for this kind of good opportunity we then bring to the people of Moyamba and that of Boya Beach community. We want to plenty thank you, and we pray let God go no more. That now waiting the people and be say, we they pray for the healthcare schedule, and they pray for the government of Sierra Leone and also the Ministry of Health. Well, now this the chairman gets for left with. Despite we continue the interview with the Deputy Chairman of Healthcare Sierra Leone USA and the solar system.
So Chairman, you get anything possible? Is there any message for the people out there?
Well, all I say is that we are unite, and possibly if you see your body, you feel not well, and for go to see doctor. But better would not find out what's wrong with you before you seek bad one before you can hospital. That's the time could only lead for you. When they come here twice a year, we go there sometimes in June.
So the chairman gets for left way, and this now the Deputy Chairman of Healthcare Sierra Leone, they did on action. They advise people them how to take their medication, and they caution them, they warn them, they tell them the good things them we didn't count for them, and we get for interview them also. So this now the chairman.
Ladies and gentlemen, this is the whole kind of we watch me live in direct. Being an MC performer of Who Wants to Studio. Today we didn't have Boya Beach for come witness the healthcare and the patronize with the Ministry of Health. Come do free medical, can give free medical to people in here, and also free medication to people. So and there with the Vice Chairman, we get a lot of service. So Chairman, if you tell people what's needed and what's over there today.
Well, thank you. My name is Dr. Kwad Sharif. I'm the Vice Chairman for Healthcare Sierra Leone. We don't do an salon for Canada Medical Mission. And the first 2 days we did our back. Now the next 3 days we did our community with the collaboration of Ministry of Health. We, as you can see, we get the mobile clinic box in the DBMV. We get 2 way the Ministry of Health needs to follow use for this mission. So this medical mission are a collaboration with the Ministry of Health. They tell thank you to the minister them and all the team of the doctor them and nurses them who they are with me. So we do a medical mission now, and the doctor can see the patient and for free of charge. They give the medicine for free of charge.
I want to know if this come is a start for a long time and our person is going on the camp and back on this mission.
This is our second mission we don't do as Healthcare Sierra Leone, never free of charge.
I want to know if this come is a start for a long time and our person is going on the camp and back on this mission.
This is our second mission we don't do as Healthcare Sierra Leone. Last year we be there local districts in Luge Hospital, we're gonna put the hospital in Makini and Royanka. This year we're gonna Moyamba Hospital and now the boy access. Now the boy access, people that come on to Bukana, people that come on river number 2 Kokaya, they come on first Kokaya. So all the people that come on now, they the event, small village them. That's the issue that we have plenty volunteer them. And one of the other volunteer them, we see on there with the dark t-shirt. Now, hope for youth Sierra Leone, we will get chapter them all over the country. This is the future chapter. They get different sets of the car yesterday. These are the other future chapter that we are today. You will see that they help or usher patients them. Come on.
We all get what the vice chairman say. Fambolem, that's not the vice chairman for the healthcare Sierra Leone USA. Fambolem, as we see plenty people we come all angle from the peninsula just for can meet Nadibue Beach community for can benefit from the free medication and also for the medicines way the healthcare Sierra Leone give to people free of charge. As we see thousands of people been so happy, then they patiently wait.
And to present to them from Healthcare Sierra Leone in the USA and Rotary Club of America, Britain, and the world, 2 mannequins and also a flip chart and also a wall action plan for the skill lab.
Because my help, not all, everybody, they get chance for Ghana or treat headache. They will get people there now and we'll try let them continue for help. I will tell you that they thank you, and then I take Thursday. When I will begin that, uncle I will swing, or that do ya, when I not shape, when I come, we'll do the right thing.
Thank you, Mr. Speaker.
Mr. Speaker, honorable members, as you see our guests here from the right, they are a batch of doctors and nurses from the USA and Sierra Leone. Their organization is Healthcare Sierra Leone. And as you know, health is wealth. We cannot move without a healthy body. So they are in Sierra Leone. They formed themselves into an organization wherein they have decided to come back home to give back to the people. They have gone to Potloko, Makeni, Royanka, and this time the lots fall on Moyamba district, where they were for the past weeks. They were there treating people for free, all ages, children.
You did not start with parliamentarians.
Yes, they are coming. Women, children, old and young. Yes, honorable members, they have not started, but they have gone to your people. So it's a plus to all of us. And for Moyamba this week, they treated about 1,500 people. And they went back to the peninsula. They were there these past days treating people for free. So, Mr. Speaker, honorable members, they are here this morning. They are from Moyamba district. They are here this morning for us to join me to appreciate their effort for what they have done or what they've been doing for the people. And we want them to do more, because this is just a start, and we are going to do like what Oliver Twist did. Please, sir and madams, we want some more. As you know the problem in Sierra Leone, you know our problems, you and I know, and the way our people are suffering. They go to the hospitals to get, even to afford Panadol, they have to go from point to point to come and buy Panadol. But now you have allayed that one. A few days ago, you gave so many drugs to the people of Moyamba district. So I want to say thank you. And also on behalf of the people of Makeni, Royanka, Lunge, and the Peninsula, I want to say thank you. The others, please don't worry. They are going back. They will come very soon. They are here and they have seen the problems that we have in our country. And I hope you go back to the US and you live with the others, because we have Dr. Soko Kadia here and the other young doctors. You will hear their names and they are here. I know they will do more. They will help us so that they can of the healthcare. So with that, the chairman there, Mr. Pierre, can you please rise for the people to see you, the honorable members? That's Mr. Pierre, born of Tayama, Moyamba district, is the brain behind everything. So I want to say on behalf of Parliament and the people of the areas that you have gone, and yes, to go to the other areas in the other provinces, because we have 11 you have had now from Parliament. You need to come to Parliament. You have to give us one time so that you can come to Parliament to see, so that we too can enjoy these facilities. Thank you very much. We appreciate you and we hope to see you again. Thank you very much, sir.
Our statement for introducing our distinguished guests this morning.
Mr. Speaker. Sorry, sir. I'm really sorry. But it's your leave.
Very well.
Thank you. Thank you for, sorry for the interruption. Thank you for giving me the floor. I want to join one of our oldest and senior colleagues in the House, the leader of the Sierra Leone delegation to the ACP, to the ECOWAS Parliament, and also the president for the ECOFEPA. Mr. Speaker, as I said, I want to say a big thank you to you for giving her the floor and by extension to me. But we want to climatize this process by the committee meeting with them, our health committee, to show that there is a parliamentary committee who are in charge of health so that they can interface. They are doing a very good job. I don't want to join her to say thank you very much. And we cannot pay you, but your patriotism will pay you. You have done what you could. They are going to ask you what you have done for your nation. That is exactly they have demonstrated. Going for greener pasture, if you achieve what you want to, this is what you give your people as a service. Health is our biggest challenge as a nation. In fact, it's a global challenge now. We are trying our best, but we have the private sector coming in, which we are anticipated for, Mr. Speaker. Thank you very much, Honorable Veronica KCC, for bringing them on board. And thank you, Mr. Speaker, for giving her the floor, for telling us about these great people, the extraordinary and what they are doing. So, as I said, the health committee will meet with them after sittings, and we have a one-to-one meeting so that they can be in touch with areas that they are going, and MP can tell them more. The end note, we are sick. We need them to see us. We need some drugs. Well, we have so many patients, Mr. Speaker. We have patients who visit here. We are professional doctors, very professional doctors. We are physicians, we are gynecologists. You call them. Oh yes, if you take my phone this door, somebody will say, oh, I've gone to the hospital to do delivery. Oh, I'm sick, I need operations. We have done all those operations. But our professionalism is in terms of physical policies that we give them money. So thank you very much, Mr. Speaker, for giving the floor. But I salute you. And people will criticize you. But your conscience is served and your God with your nation first. Push, we succeed, we are with you. If we have policies gearing towards the health sector, anywhere you are, this parliament is a very progressive parliament now. We can make your input into that particular policy that we are going to enact in parliament. The best we can give you is to make sure we have better health policy that encourage all sectors of people that are wanting to help us to come on board. So that is what we can do as parliament. Thank you, Mr. Speaker. Thank you. Yes, Mr. Speaker.
The other member from Muyamba district has been itching to catch my eye, to have a say in this important and I'm not giving you the floor.
You know why I don't tell Mr. Speaker? Thank you for even recognizing me.
I'm not giving you the floor. The leader of doctors, I think, let us qualify that so that we are well understood. SO2 will be pepper doctoring ourselves. You have the floor.
Thank you very much, Mr. Speaker. I want to join the senior colleagues for appreciating the efforts of the medical team from the United States of America to supporting our people, especially from my district. I want to thank them for that humanitarian gesture they've extended to our people from that end of part of the country. However, Mr. Speaker, just like the leader of government business rightly outlined, let's have it in a structural form, like engaging the committee, and for subsequent engagement in districts, the MPs in that district must be informed, and because we have people who are eagerly waiting for such opportunities to be given to them, but they don't have the financial support. So if we have a medical team that is giving these services free, I think it's but fitting that the members from that district be earlier informed so that they can help their people to access these facilities. Because for me, it's a laudable venture and it's very good for them to be in my district, but I'm only coming to know that they are just coming from my district through the presentation of the senior honorable member. On that note, I want to thank them, and I want them for subsequent engagement across the country. Let the MPs of this district be involved so that they can let the people to come out and let the people. Thank you very much.
I thank the honorable member for his contribution. Let me say this to our distinguished guests, that the sentiments you've just heard have all come from one side. That's the government side of the house. But it's never complete until you also hear from the opposition side. I would like to give the floor to the leader of the opposition.
Mr. Speaker, let me, on behalf of this Parliament and by extension the government of Sierra Leone, express our profound thanks and appreciation to the team. And similarly, please permit me to express similar sentiments to the previous Mama of the House. Now is the Mama of West Africa. She has been promoted to the Mama of West Africa. We want to thank you and may God bless you. But like the leader of government said, we would want to let the team coordinate with the Committee on Health, because all of the places that they're going, they are reducing the burden on members of parliament. I could remember in the last parliament, when members of parliament were questioned as to what are their roles and responsibilities in their constituency, most of them stated that they've taken care of the medical bills of thousands of their constituents. So if the member of parliament joins the team, it will give more authority to the team that came, and they will be more empowered in the various districts that they're going. So I want to reiterate what the leader of government business just said, that they should work hand in glove with the Committee on Health to ensure that it is participatory. So once more, on behalf of the opposition, we want to express our profound thanks and appreciation. And we pray that this is not the first and the last that will be coming here again. May God bless you.
I thank the leader of the opposition for his kind sentiments. Let me now exercise the privilege of having the last word on this. But before I do, I think it would be appropriate to introduce the members of the visiting team by name. The chairman has already been introduced by the honorable lady. I hope he doesn't mind rising again to be acknowledged for the second time. Dr. P. Madam Finda Kai Kamachende, Madam Fatmata Tarawali, Dr. Fuad Sharif, Mr. Cherno Abubakar Bari, I see a name that is most familiar, Madam Kali Balajal. Abdulaziz Suma, Salu Alpha, Umar Ba, Ishmael Ba. Is he with us? Oh, he's over on that. Thank you. Mohamed Toure, Lulu Abba, Charlotte Israel, and another family in this country, Dr. Soko Kali. Madam Angela Dumbuya, Bridget Ahmed Mbayo, Ella Smart, Josephine Kamara, last but by no means least, Janet Kelly. I have not omitted anyone. mothers. I want to take this opportunity on behalf of the entire public, as you well have noticed, both sides of the house, to compliment you for your humanitarian gesture and to express our warmest gratitude to all of you for coming to our country and to give to the people of this country the service that is so badly needed by everyone in this country, medical staff. I'm sure the places you visited may have said this to you, that after treating the people you met, you will not want to see you go back. But alas, you have to. But let us say, you leave us with the expectation that you'll be coming back. We appreciate the services you've given to our people. We can't thank you enough. In our traditional way, we will pray for you and say, may God shower you with his richest blessings for the good services that you render to our people. Thank you on behalf of that.